Hi, my name is Lily. I am a new grad registered nurse. It's been a couple months since I put out a new video. That is because I have been spending most of my time at my full-time job at a hospital, and I recently just passed my 3-month mark, and so I'm officially off of orientation. What that means is that I am working completely on my own. I get my own patients, I get my own assignments, I get to do total care for my own patients by myself. I really wanted to make this video kind of as an update on how I'm feeling a few months into my career as a registered nurse. First things first is I am in a better place than I really had seen myself being in. I really thought that just a few months into my job I would be feeling completely overwhelmed, really stressed. I thought I would be feeling just really burnt out. I really thought I would be at that point. I think that the environment in my hospital and my hospital itself just did a really great job at transitioning new grad nurses into the floor. The floor that I'm on actually orients a lot of new grad nurses. The floor that I'm working on is a cardiac progressive care unit. Essentially, my floor is a mix of a telemetry unit and an ICU step-down unit. We get patients who have anything cardiac related, essentially. All of the patients on my floor have a cardiac monitor. Nurses on our floor have to be EKG and ACLS certified, and I am both. So the environment on my unit has been so welcoming, and I think because there have been so many new grads that go through my floor, everyone is just very receptive to people asking questions. Everyone likes to help out one another. I feel very supported by my coworkers and also by my supervisors. I've just found that everyone has been a really great resource for me. I'm asking questions every single shift. If I'm even slightly unsure about something, I will ask. I know that I'm not afraid to ask questions, and I'm just glad that people are very receptive to me asking questions. Like, they'll answer me, and if they don't know, they'll tell me they don't know, and I can figure it out, or I can find someone else who does know. I've just had a really supportive floor, and that's really helped to make my transition into the profession just a lot smoother. So I oriented for 12 weeks. It was 1 week of corporate orientation, 1 week of sort of like clinical orientation where I go to the hospital and the educator is kind of just showing us around the hospital and telling us what we need to know to be on the floor. The rest of the 10 weeks is actual on the floor orientation. I actually switched preceptors multiple times throughout my orientation. I am on knock shift, so I work 7 p.m. to 7:30 a.m. I actually had to do 2 months of day shift orientation before I went to my last 2 weeks of night shift orientation before I started on my own. It was really helpful to have that experience. I didn't exactly enjoy it all the time, but it was really helpful to be able to experience the daytime because day shift and knock shift are so vastly different in what you can and can't do. I had 4 different preceptors actually. I had my first preceptor on days, I had a second preceptor on days, and then I was supposed to have only 1 preceptor for nights because I was only on there for 2 weeks. But because of scheduling conflicts, I ended up having to have a different preceptor for 2 days, and then I had the rest of the 4 shifts with a different preceptor. And I really, really liked having multiple preceptors because I had 4 different preceptors, and all of these nurses all have their own style and own approach to things. So that I think was really helpful for me because I was able to go at it and really just kind of see how I like to do things based on what they were doing. The first few days, I would always be trying to do exactly what the nurse was doing. I like to follow their style, and then after that, I definitely get a feel for what I like and what I don't like, and then I incorporate that into what I like to do on my own. I basically just assume total care for my patients almost from the start. Like, I had a couple shifts where my preceptor would be kind of right by my side, and then after that, they just threw everything at me. I was doing everything on my own, except when I got maybe overwhelmed or if I had too much going on or if there was something that I wasn't sure about, then they would come in and help me from there. I basically just started doing like, you know, all the assessments, all the med passes. I was doing that almost from the get-go. The great thing about California is there are nurse to patient ratios. For my floor, the ratio is 1 nurse to 3 patients if you have the step down team, or 1 nurse to 4 patients if you just have the regular telemetry patients. And there are some days where we go over ratio, but for my floor, over ratio would be 5 patients. And it's honestly, even at 4, 5 patients, it is so overwhelming. So I don't know how other nurses can do 6, 7, 8 patients at once, but those who do are seriously insane. It's amazing. The supervisors are really being gentle with my transition in. They're giving me patients who are not as acute, and they are not giving me over ratio yet. So far, the transition has been okay. I do definitely get stressed about some things on my shift, and I do see myself making really stupid little mistakes that I shouldn't be making. It's like really small mistakes that I'm making that I'm catching myself, and I'm just so thankful that the people around me have been very kind to me. In regards to patients, I have found that I really like working with the step down team just because they are higher acuity. This was me during orientation. I enjoyed it a lot. However, I do know that if I were to take the step down patients on my own right now, I think I would be overwhelmed with the kind of care that they need. It's so different. We have such a vast range of patients on my floor, so some are not so sick, some are very sick. I get a lot of patients on my floor who need to be in the ICU, but we just don't have enough ICU beds, so we're keeping them on our floor. I do work with COVID patients, and I also don't work with COVID patients, so kind of just depends on what side I'm in. I work in one of the bigger hospitals in the area that I'm in, and because my hospital is bigger, we get a lot more resources when it comes to learning. So for my floor, we had to be EKG certified. We had to take a class for that. So there were 4 classes once a week, and then we had an EKG test. And I was never great at EKGs in nursing school, but I definitely can say that I'm a lot better at them now. Being able to read EKG strips is actually essential on my floor. You can't get by with faking it on this floor. You actually have to know how to read EKG strips, so I can do that now. And yes, my hospital did pay for it, so that was a good thing. Some advice that I would give myself before I started the job kind of just would be really to pay attention to lab values. The most important thing we look at is really just potassium and creatinine and magnesium. Just those seem to be the most important values that I pay attention to at my workplace. Of course, we look at all the other lab values, but the ones that I find myself having to pay attention to the most would be potassium, creatinine, and magnesium. Make sure that you understand different ways to get vital signs. I have found myself having to do manual blood pressures on some patients just because the machine can't get a good read on them. And then there are also some patients where even the machine and the manual didn't work. I had to do a Doppler blood pressure, which I had never done before, but I learned that. I learned that when I was off of orientation, actually. And I also, like, for the first time used a bladder scan, and for the first time I put in a suppository on a patient. I've done trach care, and a lot of times we just have the respiratory therapist come and work with that, but sometimes I do have to do suctioning for patients. I've also done a lot of restraint documentation, and we, surprisingly, to me it's surprising, we get a lot of CWA patients. I've really learned the importance of doing a thorough skin check every single shift because skin surprisingly breaks down very fast, especially when it comes to moisture related breakdown. Okay, this is a very disorganized and random 3-month update, but I'm just kind of just spewing my thoughts on how I've been doing so far. I would say that, you know, so far, I'm feeling okay. I'm not feeling too overwhelmed. I'm not feeling burnt out yet. I am enjoying it. I'm learning a lot. Definitely I'm learning a lot, and I'm learning every single day that I work. And I can definitely see myself doing this job for the foreseeable future. I definitely know I have a lot I need to learn. I would say just aside from like the usual kind of just new grad frenzy that I'm in, I think I'm doing okay so far. I'm glad that I enjoy this profession that I spent lots of money in. I put a lot of school time and effort into it. So I'm glad for that, and I've had a good experience so far. I don't want to jinx myself, but I'm doing okay so far. So I kind of always thought that maybe I didn't feel so overwhelmed these first 3 months just because I was with the preceptor, so I always did have someone to fall back onto. And I can definitely see myself getting more overwhelmed and feeling more burnt out in the next few months. I can see why that could happen. I don't know if I will feel that way, but I can see why that could happen just because I am on my own now. I'm working as my own nurse under my own license with my own patients. There's a lot that could go wrong, especially since I'm so new to the job. There's a lot of stuff that I don't know. We'll come back to that in maybe another 3 months. But right now, we're doing okay. I'm looking forward to see how I can improve and evolve over the next few months. Thank you for watching.